Small changes in your grapevine can sometimes be an early warning of a more serious disease. This condition is commonly associated with Elsinoe ampelina, the fungus responsible for grape anthracnose, also known as bird's eye rot. Plants affected by this disease may show the following symptoms. The fungus attacks nearly all green parts of the grapevine, including leaves, shoots, stems, tendrils, and fruit, with young, actively growing tissues being the most vulnerable. Small brown spots first appear on the upper surface of young leaves. As they enlarge, the spots become irregular, with gray, dead centers that eventually dry out and fall away, leaving characteristic holes in the leaves. Similar lesions develop on shoots and stems, where they may cause the bark to crack, peel, and form sunken cankers that can lead to shoot tip dieback. Fruit develops small, round, purple spots that enlarge into sunken lesions with ash-gray centers and dark brown borders. As the disease progresses, berries may shrivel, dry out, fall prematurely, or remain mummified on the cluster. These distinctive ash-gray lesions give the disease its common name, bird's eye rot. This disease is often encouraged by conditions such as Elsinoe ampelina survives the winter in infected shoots and vine bark. During spring, the fungus produces spores that are spread primarily by splashing rain and wind to young leaves and shoots. Extended periods of leaf wetness, typically 12 hours or longer, combined with temperatures between 2 degrees Celsius and 32 degrees Celsius, create ideal conditions for infection. Warm, humid weather accelerates disease development, while cooler temperatures slow fungal growth. Severe infections can lead to premature leaf drop, reduced fruit quality, and significant yield losses. Many growers choose to begin with natural approaches such as applying lime sulfur or copper-based sprays before bud break in early spring can help reduce the risk of infection. When following organic production practices, use only products that are approved for organic certification. If the disease becomes more severe, additional treatments may include, whenever possible, combine preventive measures with sound cultural practices as part of an integrated disease management program. Preventive applications of lime sulfur or Bordeaux mixture at bud swell can help suppress early infections. Registered fungicides such as Captain Tam, chlorothalonil, and mancozeb may be applied to protect developing shoots and fruit. Treatments are typically repeated every 2 weeks, beginning at bud break and continuing until the berries begin to change color. To help reduce future outbreaks, plant grapevines in locations with full sunlight and good air circulation and choose resistant varieties whenever available. Maintain adequate spacing between vines and trellises to improve airflow. In home vineyards, cover infected plant debris with mulch, such as leaves or wood chips, to reduce spore release. Remove nearby wild grapevines that may serve as disease reservoirs. Inspect vines regularly and promptly remove infected fruit, leaves, and shoots. Prune during the dormant season, remove plant debris after pruning, and deeply cultivate the soil when appropriate to help bury infected material. In summary, grape anthracnose is characterized by small brown spots on young leaves that enlarge into gray, sunken lesions with dead tissue that eventually falls away, leaving holes. Similar lesions develop on shoots and stems, while fruit displays ash-gray, sunken spots with dark brown borders that may cause berries to shrivel or become mummified. Follow the channel for more practical tips on keeping your grapevines healthy and productive.